When you're interviewing for a role as a pharmacist, the best thing you can do to prepare for your interview is to practice your answers to common interview questions. While it's impossible to predict everything hiring managers will ask you, having an idea of how to answer even a few of them will calm your nerves and allow you to focus on the points you want to communicate. 10 PHARMACIST'S interview questions and answers. Question 1. Tell me about yourself. Simple answer. I've been a pharmacist for 15 years. And I love getting to constantly learn new things and solve problems, all while helping patients regain their health. Throughout my career, I've worked at small local pharmacies, in big city hospitals, and everywhere in between. I even owned my own pharmacy for a few years. Question 2. Why did you choose a career in pharmacy? Simple answer. Since childhood, I've been fascinated with the medical profession, but the most interesting part of the profession is how drugs heal different ailments. This was why I chose pharmacy, and I have been preparing myself for the role for a long time. I believe I am well equipped to deliver value to customers and help the pharmacy achieve its goals. Question 3. Tell me about your experience as a pharmacist. Simple answer. After I graduated in 2013, I started working at my hometown's local pharmacy. I quickly got good experience doing a wide variety of basic pharmaceutical tasks, and I was managing the place just a few years later. In 2017, I got a job offer from a hospital in Chicago, where I've been ever since. In that position, I've been able to learn how to handle a high-volume pharmacy with more complex orders and a larger team. Question 4. What is the responsibility of a pharmacist? Simple answer. Manage a drugstore, advising patients and physicians, verifying accuracy of prescription, reviewing possible side effects, assigning correct dosage, recommending most appropriate non-prescription drug, give information to the patient about drug interaction. Question 5. What are the record-keeping procedures that a pharmacist have to do? Simple answer. Storing pharmacy files, patient records, inventories and update system files, registries of poisons and controlled drugs. Question 6. What do you like least about being a pharmacist? Simple answer. Even though I generally enjoy my work, working with a long stream of difficult customers becomes draining. However, I remind myself that when I'm in pain or worried about myself or a loved one, I'm not always pleasant either. This helps me focus on being kind and improving their days instead of on my irritation. Question 7. How do you handle a situation where a dispute between two technicians is affecting customer service? Simple answer. I would summon both parties for a meeting before the store opens. I will allow each person to state their concerns and, together, we will work towards an amicable solution. I would make it clear to them that they can always approach me if they are having a difficult time resolving conflicts with a coworker. Question 8. What is the most vital business aspect of a pharmacist's job? Simple answer. The primary role of a pharmacist is to provide top-quality care for patients, and for me that is the most important aspect of this business. By offering customized care that addresses the unique needs of each patient, the pharmacy wins their loyalty and transforms them into long-term customers and advocates of the business. Question 9. What are the side effects of methadone? Simple answer. Feeling anxious, nervous or restless, insomnia, sleeping disorder, feeling drowsy and weak, nausea, vomiting, diarrhea, constipation, loss of appetite, dry mouth, impotence. Question 10. Describe a situation when you went out of your way to provide an exceptional performance. Simple answer. At my former employer, there was a woman who came in every week to pick up her prescription in a motorized wheelchair. I asked her why she didn't order the medication to save herself the stress of coming to the pharmacy. She told me her finances were down and couldn't afford such a luxury. When I asked how far she traveled to reach the store, I discovered she was living down the street from my apartment, so I volunteered to drop off her meds at the doorstep every week at no extra charge. These questions will be more than enough to help you gain confidence before your interview. If you like this video, then feel free to like, subscribe, and share with your friends to help them crack their interview. Stay tuned.